Hi everyone, we are from Group 4 and in this video we are going to explain the benefits of playing badminton, specifically reducing blood pressure and risk of heart disease. First, let's talk about how playing badminton can reduce our blood pressure. According to scientific studies, playing badminton constantly for over 12 weeks will cause two changes in our body which can reduce blood pressure. The first changes is reduced secretion of endothelin-1, or known as ET1. ET1 is a vasoconstrictor which will cause our blood vessels to constrict. When we have reduced ET1, it will improve our vasodilatory function and improve the stiffness of blood vessels, which contribute to the reduction of blood pressure. Secondly, playing badminton can increase the nitric oxide bioavailability in our body. Nitric oxide, or known as NO, is a molecule that is produced naturally in our body. Its main function is for vasodilation. Thus, when we have more NO in our body, it will cause our blood vessels to widen and improve our blood circulation. This will lead to lower blood pressure as NO promotes a decrease in vascular resistance.
How do badminton strengthen our heart? Badminton is one of an aerobic exercise. Aerobic exercise, then called as endurance exercise. It is the physical exercise of low to high intensity that depends primarily on the aerobic energy generating process. Aerobic then defined as the use of oxygen to adequately meet energy demands during exercise via aerobic metabolism. Since most games of badminton run longer and involve more activity, like taking shots, the body uses energy to keep active in the game. This is anaerobic energy. Next, additional badminton was found to lead to large aerobic adaptation, such as increased VO2 max, time to exhaustion in endurance exercise tests, and variable reduction in heart rate and blood lactate.
The next topic will be the awareness for sudden death in playing badminton. That will be discussed in three parts. Sudden cardiac death is defined as non-traumatic and unexpected death due to cardiac causes within 1 hour of the onset of symptoms or within 6 hours of witness normal state of health. Facts reported that a 19-year-old keen female badminton player who had suffered from sudden death was found to have mitral stenosis, in which the mitral valve is tightly narrowed and the cardiac output is reduced and is less able to respond to the sudden demands of physical exertions. The competitive stress, in addition to the physical exertion, would exaggerate blood pressure and heart rate, and thereby increasing the risk of SCD as a consequence of myocardial oxygen demands. Badminton was one of the sports that recorded a significant number of sudden deaths during sports activities. Several researchers who have studied sudden death regarding sports found that generally CAD is the most common cause of sudden death for people who are older than 30 years old. The incidents regarding sudden deaths during badminton games underline the importance of medical screening before playing badminton, as American Heart Association has recommended that some form of standardized pre-participation medical evaluation and cardiovascular screening should be mandatory for athletes. Furthermore, athletes should be restricted from competitive sports if the following situations arise. First, when valvular lesions coexist with other cardiovascular abnormalities. Second, when diagnosis of hypertrophic cardiomyopathy is unequivocal. Third, when coronary artery anomalies or myocarditis are detected. That's all from our group. Thank you for listening.